In today's video, I'll be explaining about the common myth or the theories that the people have about the pharmacist-only medication. In Australia, the medication has been divided into the different section. The common one is the pharmacy medicine, pharmacist-only medication, or there is like prescription-only medication. There is like control drug. Okay, there are different category in the Australia for the medication, and common myth or the common saying of the people are like pharmacist only medication is over the counter medication, which is totally wrong. Medication, that is the medication that need to be given by the pharmacist in the supervision of the pharmacist or by the pharmacist. It need to be approved by the pharmacist, and there should be the clinical need to use that one. Okay, and many people are saying, when I work in the pharmacy also, many people are saying, oh, my doctor has said it is over the counter medication, but why aren't you giving that medication, or my doctor know about that one. But for this medication, not only your doctor, the pharmacist also know about the condition, because this medication is the medication that need to be given by the pharmacist on their supervision. Okay, the pharmacists are the person who are liable of that medication. Like something, if something happened to you, pharmacists are the person who is responsible for providing you that medication. Okay, and for example, I'll go through one of the case scenario. Recently there was a lady and she was looking for the Voltaren 25 milligram, which has the diclofenac on that one, which is NSAIDs group of medication. She was saying she was taking that one for her pain. And okay, I was going through the questionnaire, but she was like trying to say my doctor know about that one, or many things on that one. I was trying to explain her calmly that this need to be prescribed by myself. It is like giving, it is like the way doctor write the medication to you. It is like that I'm giving that medication to you means I'm writing the medication Voltaren to you. For that one, I need to know the clinical need of that one. Why are you taking? Is there any other regular medication or not? Or do you have any medical condition or not? Are you on any other regular medication? And when I go thoroughly about that one, I found that she was pregnant. Okay, with the Voltaren NSAIDs in the pregnancy, it is not recommended. Okay, it is not recommended medication. And I go through that one, and when I try to explain that one, at first she was so rude, and after that, when I calmly try to explain everything that will cause to her pregnancy due to that medication, she was thankful for me for that one. Okay, I have refused the supply of that medication, but I have given her the alternative medication. I have given her the Panadol, paracetamol. She can use like 1 gram. 1 gram she can go up to 4 times a day. That means on total she can go up to 4 gram, which is the maximum limit. I said whenever you need it, you can go with that one. Okay, that was the thing we do. As I mentioned, with the pharmacist medication, as I was giving on my risk, so I need to know all the condition. Not only me being a pharmacist, all the pharmacists need to know all the condition, all the clinical need and clinical judgment need to be made to provide that medication. And for example, if some of the pharmacists refuse the supply or don't see the any clinical need on that medication, they have right to refuse the supply of the medication. It is the law. For the pharmacist only medication, pharmacist has a right to refuse the supply of the medication if they didn't find any clinical need. So if you are a doctor also, or the any medical health professional, and if you need the pharmacist only medication, you need to go through all the questionnaires with the pharmacist until and unless if you the a prescription for that one. For example, if the doctor is coming on the pharmacy, if I have seen some of the doctor which are so arrogant about the medication, like with the pharmacist only medication. Sometimes I have seen in like in 1000 there might be one person, in 1000 there might be one person like that. I'm not blaming any of the doctor, any healthcare professional, but they need to know that if there is a pharmacist only medication, there should be the involvement of the pharmacist, and they need to go through that one. But if they don't want that one, and they want for the different condition, they can write the prescription for that one. Yeah, that is also the other way. But if you are, for example, if you are nurse, you come to the pharmacy and you ask for the pharmacist only medication, and if there is no clinical need and pharmacist refuse the supply, you need to be calm. You can't say, oh, I'm a nurse, I know what I'm doing. You can't say that one. There is the pharmacist, he know or she knows what they are doing. And with the pharmacist only medication, there is the law. The pharmacist can refuse or deny the supply of the medication. Okay, there is the law, they can do that one, so don't panic on that one. Otherwise, if they feel that is the no clinical need for that medication, gently ask them about the other recommendation. They will go through that one by one. Okay, don't panic on that one. So that was the reason, like if there is a pharmacist medication, pharmacist need to be involved on that conversation and need to go through everything. I know some of the pharmacists might be on the hurry, or the pharmacy might be busy, so they are not caring about that one. I don't know about that. Some people are saying, because some people are saying, oh, if I go to this pharmacy, that pharmacy, they will give that medication, they won't ask any question. No one has asked those questions to me. It's their way of dealing that one. But being a pharmacist myself, I don't know what other pharmacists are doing or what my colleague in my pharmacy is doing. But being a pharmacist, I need to follow the rules. I'm here to follow the rules and regulation. I'm here to make my judgment. I'm here to give the medication on the need of the clinical judgment for the pharmacist only medication. So I'm following the rule. You also need to do that. Again, in the end of the day, that's up to you. And thank you so much for listening my words on this video, and thank you for sticking to the end of the video. And if you like the video, share this video to everyone, and let's grow the channel to the bigger. And thank you everyone. Have a good day. Bye.